And so, what inspired you in your program to really endeavor to make services more accessible and more responsive for survivors who use substances?
This is a really great question. And I think it really stems from what I just spoke to in a rural community. We have bare minimum, maybe even less than the minimum types of resources for individuals who use substances, whether that's they want to get clean, whether they don't, whether they're looking for support, whether they're not, whether they're just looking for, safe use or harm reduction, whatever stage they may be experiencing. We have zero detox options in our community. We have only one Medicaid accepting facility for treatment, and that is usually dominated by court order treatment. And so anybody who wants to do that without a court order has to pay a lot, or they have to leave the area, which can be really, really difficult. We don't have any residential facilities that can accommodate moms with kids or dads with kids or any kind of guardian and child relationship, which we're learning more and more is extremely necessary in recovery to have those safe connections. And so it kind of grew out of a necessity where we were seeing individuals who really needed safety, which is the primary thing we've provided for a long time in regards to domestic violence and sexual assault. They needed safety, physical safety because of shelter or safety in our support groups or assistance with protective orders or whatever it might be. And a lot of our old policies and procedures or the way that we practiced certain types of advocacy really lent to the idea of, drugs are bad. And how do I say this delicately or indelicately? The DARE program, I don't know if that's nationwide or if that's a Utah thing, but drugs are bad and people who do drugs are bad and they can't possibly have good intentions if they're using drugs and they just need to stop. And we just didn't see that narrative really actually matched the individuals we were working with. And when we were turning people away because they were actively using or even smoking marijuana or smelled of marijuana, or we found burnt spoons in their bags because we used to search people who came in, we would turn them away. And it really kind of got to a place where we were like, these individuals have absolutely nowhere else to go. And so we have to make a decision as a program. Is their safety, do they have the same rights to being safe and protected as someone who doesn't have the same types of coping mechanism or whatever that mechanism for use is, or do they not? And it was overwhelming, and it was a buy-in that we had to get from the entire staff to say we all have to be on the same page about this, because if one person is treating the clients differently, then it's on the entire program, and we need everyone's buy-in to make this work. And so it was really easy once we had that conversation about who deserves safety and who doesn't. Then we knew, okay, well, we think everyone deserves that safety unless they are taking from other people's safety, whether that, they're physically violent towards someone or threatening that violence. And that's the bar. And so we have to find a way to work around and provide them that safety while also still acknowledging those stigmas and concerns that other people who may not be using substances or may not have been around individuals who use, in order for them to kind of live in our shelter in a coexisting and healthy way. So long story short, safety, that's the bar.
Yes, thank you.